The step-by-step technique for collecting a culture is as follows. Perform hand hygiene according to the national guidelines. Collect all the required material and place it on a clean tray. Check the expiration date of all the items to be used. Mark the optimal filling volume on the vials if this is not already indicated. Put on gloves. Apply the tourniquet. Apply skin antisepsis for 30 seconds and leave to air dry fully. Do not repalpate the vein. If necessary, wear sterile gloves. Flip the plastic cap off the bottle. Disinfect the vial using an individual alcohol wipe and leave to air dry fully. Avoid using bottles of disinfectant which could be contaminated. Collect the blood using a safety butterfly needle with an adapter, allowing the blood to flow directly into the vials. Keep the vial in a vertical position during filling, ideally under the patient's arm where possible. This will allow the precise volume to be read accurately. Fill each vial with approximately 10 ml of blood for adult patients, first filling the aerobic vial, then the anaerobic one. Remove the tourniquet as soon as the blood begins to flow or within 1 minute of application. Remove the vials as they are filled and gently shake them. Activate the needle safety system when removing it from the vein. Dispose of the needle in the appropriate container for sharps waste. Perform hemostasis with a dry buffer or stabilise the site according to local procedures. Remove gloves and perform hand hygiene. Report all necessary information on the vials. This includes the sampling site, time and date, and patient identifiers. Mark the execution of the blood culture on the patient's medical record. Send the vials immediately to the laboratory. A maximum of 4 hours should elapse before they are loaded onto the analyzer, but many trusts are achieving this in under 1 hour. By following these guidelines, you will help us achieve an optimal blood culture pathway.